Well, Healthcare Improvement Scotland is a national improvement agency here in Scotland, and we've been involved in safety and improving safety for a number of years now. So the framework was commissioned by the Health Foundation, and it was led by Professor Charles Vincent of Imperial College. And Charles was asked, can you find out how safe care is? And how do people monitor and measure safety? Charles looked at the healthcare literature, he looked at high-performing healthcare organisations, and he looked out with healthcare to other industries to answer that question. Well, we know that safety is complex, and the measurement and monitoring of safety even more complex still. Well, the framework is trying to give us a better perspective on safety. It causes us to shift our thinking from just monitoring and measuring things in the past to looking at what's happening now, predicting what's going to happen next, and learning from all of the information that's available. That's a major shift. Well, we were very fortunate to be working with NHS Borders and NHS Tayside, two organisations that are absolutely committed to safety. We worked with them to identify how the framework might be tested locally, and then again how we could test the framework and work with other UK organisations. Well, we worked with the teams in a variety of ways, including face-to-face meetings, programme boards, an online community, WebExes and huddles. We've run a series of events here in Scotland and indeed in the United Kingdom. And when we've got together, we've always tried to learn together. So bringing the ideas from the local teams and learn together. And of course, it's with that sharing of stories that we get light bulb moments. Things like when we had Jane Carthy in Edinburgh. When she was looking at the framework, she brought learning and integration into the middle of the framework. That was a light bulb moment for us. Jane also reminded us of the importance of putting the patient right at the centre. And she told the story of her mother-in-law and how, looking from her mother-in-law's perspective, how all of the bubbles, all of the perspectives were important. From the early days of reading about the framework and testing the framework, we've realised that of course it has application within our safety programmes, but actually in our quality of care reviews, in our adverse event reporting or suicide reviews, there's lots of elements of the framework that can be applied there too. Well, the testing both in Scotland and in the wider United Kingdom has given us an opportunity to use the framework in a variety of settings. And you know what? It's worked really well in those settings. We do believe that perhaps the integration and learning could be in the centre of the framework to remind us that that's the whole purpose of the framework. So it's really important we share what we've learned. And we've done that through our website, through Twitter activity, and we're creating case studies around what we've learned through the programme. This is a very exciting time. We've done some testing. We've done what Charles asked us to do. Charles said, test the framework, let me know whether it works. And we believe it does work. Now we want to test it more widely, both in Scotland and across the United Kingdom.